Hi, my name is Dr. Ross Hauser. Welcome to the Hauser Neck Center here in Fort Myers, Florida. You guys are in for a great treat as I talk to Anna here. We're going to learn about, what if you have symptoms of multiple sclerosis? Is there something you can do about it? We're going to learn about the World Equestrian Center, so that's not something that I knew about before I met Anna. We're going to talk about crazy tongue symptoms, people who have burning mouth or you can't control your tongue so well. Could it be that all these things are related to ligamentous cervical instability? Now, we've known each other, has it been about a year or when did we first meet?
It's been about 5 or 6 months now.
Okay.
May, I think, that's when we first met.
And you had quite a journey before you came here, and they were.
I did.
You're one of those people that has had a gazillion scans.
I've been everywhere.
Because they thought you had MS, right? They really thought.
I think that most of the doctors, to be fair, felt like I didn't always fall into the category of MS, but knowing the kind of extreme symptoms, they did do a really good job of ruling it out, and they had multiple brain and spine MRIs. I've had multiple CTs. I've had a LP, lumbar puncture, all kinds of blood work. I've been to 4 different hospitals in the journey, as a lot of people, I think, potentially have by the time they find you.
Yeah. What symptoms did you have that was so worrisome to you and the doctors that you got all those scans?
I had full left-sided weakness. The real symptom list is about that long, but I had from left-sided weakness, numbness, tingling in my hand. My left leg was unstable. My weakness was a big thing. The left side of my face would puff up. My tongue would go numb just on the left side. It would vesiculate when I would try to hold it out. My jaw would shake when I moved it to the left. And those are just the first few that I can think of off the top of my head.
Why don't you just quickly go through the list, like go through the body parts? Your brain, your eyes, your voice.
Yeah, incredible brain fog, double vision, light sensitivity, light tracking issues. So just creating just different shapes based on light, and full fatigue, difficulty swallowing, right? That was another one related to the cranial nerves. Really odd TMJ issues, which we kept saying that is so relative to the upper cervical, and kept asking doctors about that because I was like, this isn't normal in my history. Mm-hmm. And then, the left streak on my eye and the puffiness, and then, extreme weakness, uncoordinated, unstable. When I would wake up in the middle of the night, especially if I fell asleep with my head crooked, I definitely could track that. I would go to stand up and I would be just terribly off. I would regularly just kind of crash into the wall as I was trying to go to the bathroom in the middle of the night. And then I would just kind of come to and get straightened out. I don't have any of that anymore. Just pop right up, no problem. And so all of those things building up, I think I was a little bit of a confusing patient because I had a very high drive and compensation level that I would just kind of try to shake it off and try to do things a different way, and had an incredible team behind me of physical therapist and personal trainer and people who were helping me to stay as fit and strong as possible, which was a little bit confusing being at the hospitals too.
You're driven and you're a high achiever, obviously.
So it was a bit hard to decipher the symptoms, but definitely got some psychiatric diagnoses, whatever.
Yeah, what kind did you have? Anxiety, depression?
They said they couldn't say any of that because they could tell I'm a very happy person with.
Did they ever say you had conversion disorder or some kind of?
They wanted me to see a psychiatrist and then have them further look into it. And they offered medication, which I didn't feel was relevant. And then actually at the end, there was another diagnosis of, I could see this when I looked into it. Again, a very sympathetic, complex case, but basilar migraines. And so that I looked into, and I was like, that kind of makes sense. But then I was like, it's genetic, usually onset in the 30s. And I was like, this was just when I had these really traumatic neck injuries.
Yeah.
And there was a lot that I was uncomfortable with about that diagnosis, and then medication being the answer. And it's funny because I probably would have tried it, and it probably would have taken me even longer to find you. But
because you would have gotten some temporary relief.
Potentially, but we found out I was pregnant and then couldn't take the medication anyway. And that just pushed me into one more checkbox of why I had researched your clinic. Probably found this 2 months before I even got that diagnosis. And that's where I was like, nope, I'm going to go there. And here I am. And
let's
everything
just go
has
through.
been amazing.
So you came in, and then what was your understanding of what we found, and then how have you done?
I felt like I was just dying to have the digital motion x-rays and all the testing, because I had done a lot of research on the clinic, and everything that you found was actually the biggest relief to me, because it made
actually
sense.
Something wrong.
And it just made sense. Everything that you were pointing out exactly correlated to my feelings and everything that I had felt with symptoms. So it completely made sense. It was a huge relief. Like looking at the imaging with you and just being like, okay, this makes sense. And a lot of it in all the testing, I had always kind of complained that all of the imaging was done like this. And I said that if I was here, I felt okay. I was like, something's wrong when I'm moving.
Yeah, when you turn.
And that's what was what was so incredible.
In a weird sort of way, the key to your case in a weird sort of way was just that numb tongue. Because I remember my first case, it must have been like 26 years ago or so. I remember, and this was before the internet. Like I literally had to go to the library. I actually had to go to the library, and I researched, like, the person gave me the history. Doc, I'm just telling you, I turn my head like to the right, and my left side of my tongue gets numb. And then there literally was a syndrome. There was like a numb tongue syndrome. And then I treated the person, and then it's, they had other symptoms like dizziness and different things. But they got completely better. And then, so whenever if somebody has like numbness on just one half of your tongue, it's almost assuredly you're going to have some kind of a upper cervical instability. So that was kind of a weird sort of, when you first said that, I said, I know for sure you're going to end up having ligamentous.
And that was also a really fun one to track in the last 5 months, because I think on the second visit, I had mentioned that I had sat on my horses again and ridden, just walking, but I could tell that even the movement, I was trying to be careful with my posture, but I said I didn't have any of the other extreme symptoms, but I did have the left tongue, and you said, moderation, everything, and let's see how it goes. And I was very busy teaching and decided that I didn't want to push it. And then by the leading up to the fourth treatment, I rode a little bit more, and I couldn't believe. And now between 4 and 5, I have been able to ride as much as pregnancy will allow, and trotting and cantering and getting back to more normal things, and don't have any tongue numbness anymore, which has been incredible.
Can you stick it out and it's okay? Where before you couldn't even do that. And then you couldn't even, it's like, so we'll show videos of how you were before. Yeah.
Before, it was my jaw.
Like it would start shaking. Yeah. And
I can just hold it. And the only reason I knew that, because that's an odd movement to make, is I had all these TMJ exercises where it was move it left, move it right. And I had done them pre-neck injuries when I had little TMJs. My physical therapist just, hey, here's some exercises to keep these muscles looser. And then all of a sudden, after all of this happened, I just went to do my TMJ exercises and realized that when I put my jaw to the side, as you'll see in that video, it would just ferociously shake. And it was like, whoa, what is that? And
you
same
knew
thing.
something was wrong.
And I would, with my tongue, I would say to my physical therapist, we would sit and I would say, okay, no, hold on. I can make it still. This is still. And he would look at me very politely and he's like, it's still moving a lot. And now it's perfectly still.
Did you kind of know within like your own soul, if you will, that you did have a neck problem?
Yes.
Like what made you think like you knew you had a neck problem? Was it like it was clicking or?
Yes, I had clicking pop. I mean, this doesn't, ligamentous things don't always need traumatic injuries. But mine, I did have a very traumatic torsion injury.
From a horse or
from flipping and having a horse land on me with my head sideways and split my helmet open and all kinds of. I knew I had that. I knew I had recovered from it, and then I had to keep a journal, and then we would go back and try to look at different factors, and I kept going back to when my symptoms were occurring. They were each after a whiplash.
Okay.
And so and I kept saying that the pain that I would have, the clicking that I would have, and then my research on the symptoms, the swallowing, difficulty swallowing, the tongue thing, and a few other different things. I kept going back to the cranial nerves, and actually how I found Caring Medical and the Hauser Neck Center was my final straw was the vagus nerve. I became, and I don't know whether it was actually relative or not, but I found an article about digestive health because I became out of the blue allergic to gluten.
Okay.
And I kept saying that, breathing issues, vagus nerve. If I didn't concentrate on breathing, I would think that I just wasn't good. I would breathe out and I just actually wouldn't breathe in sometimes.
Okay.
I mean, obviously when I fell asleep, I was fine, but when I would get really fatigued, and that's where I kept saying, I was like, that's a vagus nerve thing. And then again, when I came in here and, you were like, this is extremely small and had a lot of pressure and everything. It all made sense. And so I just felt like I was down here in my problem solving before I found the Hauser Neck Clinic, because I just felt like I was kind of clawing through the broad information without having the help of professionals who could keep directing it. But we did feel like it was something wrong in this region. We just didn't know how to go about it.
Now here, like, I never knew about like the equestrian center. Can you just explain a little bit about that? Because most of us don't have horses.
Sure.
We don't have your family. That's like a really important thing for your family. And then, did you grow up with horses? And were you a competitor?
Yes. So lucky enough to have grown up with horses since I was 5.
Okay.
And now it is my business, and ride and train and compete, train other people's horses, sell horses. And we have a farm in Ocala, and Ocala is now the home of the World Equestrian Center. Our particular discipline of eventing doesn't focus at the World Equestrian Center, but it's an incredible venue for us to be able to get our horses exposed to a very incredible atmosphere. They have so much going on for the community. There's jumpers, dressage, all types of disciplines there. And the Roberts have built a pretty incredible place.
Do you know them?
No, I do not know them personally.
Okay, so what's the discipline that you
Eventing.
So eventing. So I'm not a horse person. So what is that?
It's like a horse. It's like a horse triathlon, basically.
Okay, so
we have 3 phases. One is dressage, one is show jumping, and one is cross country. Cross country makes it unique. Dressage and show jumping are also each their own separate sport, and then ours is again like the triathlon version.
How long do you have to go with the cross country?
Cross country is anywhere from 4 to 11 minutes, depending on the level, and across miles of terrain and obstacles and into water and over ditches
Is
and
it
banks.
just time, or you're also judged in the cross country
On the jumping
technique?
efforts.
You are?
Yep.
Okay.
And so you have these massive jumps that you do along the way. It was actually, eventing was originated from the cavalry. As to test horses going into battle. The dressage was to make sure that they were trained so well that they would listen to your every move. And then the cross country was for their bravery and that they could go into the battlegrounds and the fields and all the different terrain. And then the show jumping was a test at the end of everything of can they be careful and not knock the poles down, and then therefore get your soldiers home.
What's your favorite of the 3 disciplines, and like the one that you like the most or the one that you're
probably
best
cross country.
Okay, that's what I thought. Yeah, that's what I thought you were going to say.
It's quite an experience with your horse, as far as what you're being tested between the two of you, and the partnership and the bond that you have to be successful is really incredible. So it's very unique and very, very, very cool.
What do you love so much about horses?
Oh, they are just incredible in a million ways. Their heart, their drive, their intelligence, they're incredibly passionate animals, huge personalities. I think that as much as we teach them, they teach us back, and that's pretty cool, to have such a reflective partner that even though you might be the leader at times, they are certainly pointing out things about us as well. So they're just incredible beings, athletes too.
How did you guys end up from Vermont to Florida? Like, how did you end up?
Florida, so for our discipline to be able to train down here, the winter, but I guess the winter is the short of it.
Because you wanted to do it full time,
to do it all year, is a big thing. I think there's just a lot of opportunity with the venues and everything down here. So.
And then you and I had a discussion. Like, I try to, as much as I can, when someone has a passion of something. Like, I'll give you an example. Like, obviously the baby. Like, everything's about the baby. So, like, the babies know. Like, mama's happy, mama's not happy. So I just knew that you needed to be on your horse, like for your healing,
said that the first,
for your healing and everything. So as long as you and I had a good understanding of like protecting your investment of the prolotherapy, and then it's just worked out good. It just worked out good. Like
that was really refreshing when I came here too. Was that it wasn't. You didn't look at me and say, everything's fine as long as you never ride again. You said, I will get you healthy to be able to do what you're passionate about. That was the best thing I could have ever heard.
Yeah. And sometimes I do like to interview people like when they're in the middle of their course. So I appreciate you coming on, Anna.
Yeah.
So where would you say you're at? Like, what are the things that maybe...
I feel incredible.
What are the things that have drastically gotten better and maybe things that are slower?
I think the majority of things have drastically gotten better. The brain fog, I don't have any double vision. I don't have any light sensitivity. I don't have any left-sided weakness. I'm stable. I'm strong on my left side. My tongue is good. My jaw is good. Ever so slight, with jugular vein coming last, where I feel really good as long as I do the recommended, lay down for 5 minutes every once in a while to just help with that drainage. That has made improvements. It's a little bit slower than the rest, but it's also the least, it's been one of the least problematic symptoms. So it's not been something that slows me down. It doesn't change my day-to-day life. I just go, okay, this is, my eye has a little bit of streak, a little bit of pressure. Don't forget to do your lay downs, and it's coming, and the neck posture is coming. But with all the other symptoms, people have asked me, how's the 3rd trimester of pregnancy going? And I respond, pregnancy has been amazing and wonderful. And I have the fatigue that I know is real. And of course, sure, I get a little bit tired in the 3rd trimester. It has been nothing compared to the last 2 years of neurologic fatigue. So it's just been, I have been just so encouraged and feel amazing.
Oh, great. So happy for you. It's almost like in the human body, the central focus of everything, you and I might say the easiest place for the whole system to go awry is like at the atlas. Like if you're gonna like do one like think about how God designed the body, that the atlas is like right here, like it's underneath here, it's like right here, so it's really protected. So unfortunately with head traumas or falling off of a horse or looking down at a cell phone for hours and hours year after year, that part starts to get loose, if you will. So then your head's on something loose, then it affects like the nerve impulses, because all the nerve impulses. So you were getting too much spinal cord tension on the left side of your spinal cord, and then all of a sudden
affecting everything.
And then because it's intermittent, so then you get an MRI and it's like the MRI doesn't show any degeneration because the nerve impulses are intermittently getting blocked, similar to like lights flickering. So then they can't find it, but you know it's, because again, it's like, why would one day maybe it's a little bit better and another day it's terrible? It's because it's intermittently getting blocked depending on your anatomy. And then now as the ligaments get stronger, it's harder and harder for your body to get in a position where so that's kind of all it is. And then the smart way to do it is that, you get treated, we try some more things, like you do more and more activities, and we do it smart. Because, you're entering this time of your pregnancy where your body's going to start getting the ligaments loose, right?
Yeah, the relaxin
you could see,
hormone.
Yeah, you could see where.
Absolutely. That's the other thing about what's been amazing about, and we were speaking of it earlier, of the progress that we have been able to make, even despite, I am, ligaments relax in pregnancy, and it's systemic and it's the whole body. And I have still been able to have this steady improvement. And it's okay if, things get slightly more unstable at the very, very end of pregnancy. That's part of it, and that's okay. And it's all going to come back again. So
yeah, exactly. That's the right attitude.
Yeah.
And then just you being happy, the baby knows that you're happy. So because over time it's like pregnant gals are like and I'm pregnant, so I shouldn't get any medical therapy and this and that. And it's like, we do it safely. You and I had a conversation of like the solution, like, do we want to have some lidocaine or some cane in there or not in there? And then you and I discussed, because you can make the prolotherapy solution all natural. You can do just your blood. You can do components of your blood. You can do salt water, like the body has salt water. You could do the dextrose, which is the normal sugar. So so someone who's pregnant, you can get prolotherapy. You can get prolotherapy without any chemicals in it.
Yes, absolutely.
Because it's always like, because in other words, like if a pregnant gal sprains her ankle, nobody's worried like, oh, this sprained ankle is going to do something to the baby. Like your body is going to try to prolotherapy the ankle to get so all we're doing with prolotherapy is just stimulating the normal healing response in the body. And then you and I had talked about that. And then the other thing too, I said to you, I don't know if you remember this on the first visit, I said to you, what you do is when mamas who are pregnant, so mama's pregnant, you just tell the baby, mama's going to have to get a therapy. We're going to have to get a therapy. We're going to do it together. It's going to be good for us. And then more and more they're realizing, like, the baby knows what mama's thinking,
what's going on, and it's like it's all going to be okay. And look at where we are.
No, exactly. But thank you so much.
Thank you,
guys. A very interesting interview.
So fun.
Thanks for sharing.
Thank you.